Welcome to our faculty development video on feedback. I'm Kathy McLean, I'm the Director of Faculty Development, and I'm joined today.
Sean Polrice, and I'm the Teaching and Learning Specialist with Faculty Development.
This is one of the most common topics that we get asked to present on, and so we're really excited to have this video for you to be able to review. It's called Making It Count, and it's tips on effective feedback.
We'll start with our disclosure slide. We use a lot of images and pictures and comics, and they have attribution, permission, and or have been purchased. And a little cartoon to start you off.
And neither one of us have any disclosures.
And we don't have any other disclosures.
These are our objectives. We'd like for you to be able to describe the importance of feedback, and we're going to be doing this within a coaching context. We also would like to be able to have you demonstrate some effective skills for using feedback. And we're going to talk about some frameworks in which you can apply feedback in your teaching practice.
So here's the outline. We've got feedback in coaching. As Kathy mentioned, we really want to embed this within a context of coaching. And the part two will be the characteristics. We're going to watch a little video clip to get us going. And then we've got a few concepts that we think are really, really important in terms of giving effective feedback. So you'll see them there, the growth mindset, some helpful vocabulary to use, and we'll discuss the ladder of inference. And we'll finish with a model, framework that will hopefully help you with your feedback conversations. The acronym is ARCH, and we'll walk you through that as part three.
And I think I'm going to add that this is going to be relevant to both family physicians and Royal College specialists, and we'll probably mention some models that are very applicable to the two different colleges.
Okay, so we'll start with just some images of coaching in some other areas that aren't medicine. And we want you to start thinking a little bit about if you want to improve performance in other areas of your life, and you'll see lots of sports and music kind of analogies here on the screen. We want you to think about, well, how do you get better? Like, how do you improve your performance? And you'll notice in all of these images, you'll see somebody practicing and somebody helping them, and somebody coaching them and giving them feedback, which is what they need to improve their skills.
I think this whole concept of coaching is still relatively new to medical education. It's certainly been around in the literature, but in terms of us developing skills as coaches, we're still in the early stages. But we're drawing from the experience of coaching from music and from sports, and there's a lot that we can learn and apply in medical education.
So yeah, we want you to be thinking about your teaching in medicine in the similar kind of framework. And so we've just got some images here. They're stock images of some different kind of contexts or environments you might find yourself teaching in. And we want you to be thinking of, okay, so how do I coach in these contexts similarly to what coaching happens in things like music and sports and those kinds of things.
The whole basis of competency-based medical education, I think, has really lend itself to the whole coaching approach. And we're now adjusting and implementing those new models of teaching, so this is a really good fit, and it works really well in work-based settings.
And we have a little note there about EPAs. Many of you will be familiar with EPAs, especially the Royal College. So those are entrustable professional activities, and they're explicit activities that learners are expected to be able to perform. And so those are the things that we would ask you to coach around. And if you teach in undergrad, you will also probably notice that EPAs have become prominent there as well. And family medicine doesn't call them EPAs, but they have a similar competency-based structure.
Some family medicine programs actually do use entrustable professional activities, but not all. So there is some flexibility in how competency-based education and assessment is applied depending on where you're practicing.
Yeah. Okay, so the first thing that we're going to do is kind of describe the philosophy of coaching and what's involved in coaching, and that's going to lead us into feedback. So we'll just take a few points that we think are very crucial in terms of what's important with coaching. And the first is a relationship. And you might see some distinctions between coaching and the traditional way of thinking about teaching in this slide. in that sometimes teaching is a little bit less so. But in coaching, you typically have a good relationship between the coach and the coachee. And as you can see there, there's a lot of communication. You have to trust each other, and there's mutual respect going on. And those things are key. And when we go through the framework, we'll also highlight this then as well.
Yeah, I think that relationship is a really important thing to invest in early on if you want to be successful in the coaching that you're going to be doing.
Yes, crucial. The second point we want to highlight is that coaching is all about growth. So it's developmental over time. You're always expecting to improve. And one of the keys that I think with that is that every one of us then can benefit from coaching no matter where we are in our skill level and in our practice. We can always improve. And so it's kind of a mutual growth between coach and coachee, and you're always looking just to get better, essentially.
And that's the whole culture of medicine that we're trying to shift, is more towards that quality improvement and growth to better serve our patients. So by integrating this, I think, with learners early on in their medical education, and then modeling it as practicing physicians and teachers, hopefully we can start to see that shift in culture in medicine.
Definitely, and I love that point about modeling it and seeking opportunities to grow ourselves, even if we're coaching more junior learners. A third part, and Kathy mentioned that this works really well in workplace-based teaching and learning and assessments. Observation is key, and especially direct observation is kind of the gold standard. If you can watch a learner and see what they're doing, it allows you then to coach them much better than if you're just listening to them talk about an experience that they've had. And then the final point leads us into feedback. One of the crucial aspects of coaching is to be able to give some high quality feedback so that your learner is able to incorporate that, keep doing what they're doing well, and focus on some of the things that they need to improve on.
I think one of the key differences, though, within a coaching context is that the feedback we give is often learner driven.
Yeah.
And that's probably quite different from perhaps how a lot of physicians were trained themselves.
Yeah, and our model, the one we focus on with Arch, you will see that it's very interactive and it incorporates a lot of input from the learner. So that learner-driven aspect is really, really important. Okay, so here's a cartoon, and at any point when there's a cartoon up, feel free to stop the video and ruminate on it a little bit if you like. They're there for humor, but they're also there to make a point. And the question is, what's wrong with this feedback? So if you look at this cartoon, again, maybe pause and think about some of the things that this kind of feedback might not do well.
I love this cartoon because a lot of people think that feedback is specifically about maybe being honest or those types of things, and sometimes being honest doesn't actually involve something that one can do anything about.
That's right. And when we talk about vocabulary, you'll see maybe how that comes into play too, how we can word things in such ways that are more constructive and helpful and useful. So hopefully you'll see that this feedback is not very useful or helpful, and the dad probably doesn't really know what to do with it. He probably can't change much. But what is it? Is it the glasses? Is it the hair? Is it the dress? Is it the tie? Like, what is it? Like, he has nothing to go on. So it does make a really strong point about that. Okay, so we have a list of feedback examples here, and these are things that you might see written on a written feedback assessment, or it might be just something that's verbally said to a learner. And we want you to think about, what a learner might do with these types of phrases and comments.
Yeah, we'll often see comments like this, for instance, on an ITER, on 145 or something like that.
And these are actually, I asked somebody to give me some examples. These are actual examples. We've tweaked them a little bit based on the specialty we're dealing with, and this is more generic session. But and they come up a lot.
Mm-hmm. They do.
And so what we want to encourage you to do is to move away from this. It's not that it's not a good idea to tell somebody they're doing a good job. It's just as valuable feedback that only goes so far. And it goes about as far as those little emojis on the bottom indicate. I can point to them. So they're nice. It's nice to get it like the green smiley face, but what do I do with that? Or even the frowny face. Okay, I know I need to do better, but what do I do with that?
Yes. What is it that I need to do better? Or how is it that I was good today? Like, you really need the specifics if it's going to be valuable.
Even in
terms of
something
learning.
that's a positive, you know, if you say good knowledge base, what does a learner do with that? Like, they don't know what their strength is out of that. And learners have a million things on their minds too that you have to keep in mind, and they're thinking, what else should I? So we need to point out what they're doing right specifically as well, so that they keep doing it. So we have a kind of a
Yes.
move on from this. These aren't
In
the best
general.
examples.
Yeah, let's stay away from these.
Yeah. So I think one of the keys to understanding the skills of feedback is to make sure that we're all, you know, aware and remind ourselves of what feedback is for. And if we think back to those images of the, you know, the musicians and the athletes practicing, feedback is so that they can improve. And so those statements on the previous page or slide don't really give any hints as to improvement.
I love the expression feedback for learning.
Yeah.
That the purpose of the feedback is to help promote and facilitate learning.
Yeah, so we don't have to go through these. You can read them, but we want to, you know, make sure that learners know where they're strong and where their gaps are, and probably, hopefully, have some idea on how to improve those gaps. We want to be able to watch them over time. That's the whole competency-based, growth-oriented coaching approach. And the last point on here, it's really hard to be motivated if you don't really know what you're supposed to be doing. So what am I supposed to do to get better? I need some guidance as a learner. Or I need to come up with some strategies, and the teacher or the coach can help them develop those strategies. Kathy, anything more to say about the purpose?
I think overall, this sort of summarizes the key purpose. I think sometimes we need a reminding of why we're providing the feedback, and that we want to do it in a way that does provide that guidance. You don't want to shut somebody down. You don't want to create a really negative experience for the learner around getting feedback. If we could just, I know a lot of people just dread the word feedback. If we could just, recenter ourselves around this purpose and recognize that it really is about the learning and getting better and improving, I think we would do so much better, and we'd feel a whole lot better about giving feedback or getting it.
Yeah, well, I agree with that. With this mindset in mind, I think you can look more forward to your feedback encounters. Like, this is a conversation about how we're going to get better. And you're coaching future colleagues of yours, so you want them to improve. You want them to develop confidence and skills. So it's all good. Yep. It's a good thing. Okay, so this is kind of a little bit out there.
It's fun.
We hopefully you find this enjoyable. Those of you who have seen the movie School of Rock will recognize the characters in here. And if you haven't seen the movie, you might want to go out and see it, because it's a lot of fun and it's got a very uplifting message. But there's more than one moment in this movie, but there's one kind of 1 minute stretch that we think is just the epitome of good coaching and feedback. And so we want to show that to you. And while you're watching it, we want you to think about, what are some of the skills that Dewey Finn, who's Jack Black in the movie, what are some of the skills that he's doing to help coach his guitar player in his band? And then after that, we'll ask you to pause and come up with your list from that, and then we'll share kind of some of the key skills. So we're really focusing on coaching skills, what helps a learner get better.
It's a great video.
So after watching the video, and hopefully you paused now and thought a little bit about some of the skills, I'm hoping you came up with about a half a dozen, because there are so many things that he does well. And it's just, what are the things that he does that make it so effective? And what I'll point out here before we get into the skills is, what he doesn't do is say, Zach, you're doing good, but you just need to try a little bit more. That's probably not going to help Zach. In fact, we can see at the end of that clip Zach's transformation already. And if you can imagine if Dewey Finn had told him this, Zach probably would just be wide-eyed like, what else should I do? How about read a little more or watch some videos of some good guitar players?
So one of the things that we hope is noticed is how specific the feedback is. The other thing I love about this video is how positively it is conveyed. It's encouraging, it's enthusiastic, it's clearly meant to elevate the performance, but does it in such a humorous and gentle way.
Yes, I couldn't agree more. Okay, so these are some of our keys, and I'm going to draw also from the video for some of these. So as Kathy mentioned already, very specific skills to improve on. It's timely, it's right in the moment. Zach gets to work on it right then.
And then and there he applies it.
Yeah, and he gets him to apply it right away. He reinforces what's done well, because Zach says, I was playing it like you taught me, and he says, yeah, that part's really good, that's perfect. But then he wants to transform Zach into a little bit more of a showman or a show person, and those are the skills he needs to work on. So reinforce what's done well, and some guidance for improvement. And how does Jack Black or Dewey Finn do that? He demonstrates. He says, this is what you got to do, and he does the rock stance. Yeah. And then he shows him what he's got to do with his head and his eyes and all those kinds of things. He demonstrates all of these things. So that's good guidance. Now, some of your learners will be more advanced, and they'll come up with some of that. You'll ask them, so what could you do to improve here? Zach's not quite there. Zach's, he's a newbie. He's a novice. And so Dewey Finn's not going to turn him into Angus Young here, but he's going to give him a few things he can do that is going to improve him to get better. He's not expecting the world from him, but he gives him a little bit of guidance. And Zach needs some guidance. Some of your learners will need less, some will need more. And we'll talk about those conversations you need to have with them to find that out. Kathy talked about this, like how encouraging and supportive. You could see Dewey Finn getting excited as Zach was getting better, and learners, coachees will feed off of that. I already talked about how appropriate this is for Zach's level. He's kind of a novice in terms of trying to be a rock star kind of level guitar player. And related to objectives. Now, Dewey Finn didn't have specific objectives, but we do in medicine. And your feedback should be oriented towards what the outcome is supposed to be, and not some esoteric thing that maybe isn't that related to what the objectives or the EPAs are. Kathy, anything to add with the skills?
No, but I think it's hard sometimes for us as physicians, especially if we have a lot of experience. We sometimes have our own idea of what's important, and sometimes teach outside of the objectives. And there can be relevance and an opportunity to do that from time to time, but sometimes what we're trying to teach is actually not at the appropriate level for the learner and not a part of the objectives for that particular rotation. And we have to trust that all that's going to come together in the system, and not sort of always focus on the things that are just important to us.
Right, right. And it's understandable.
It is, totally.
It's understandable.
Those are the things we care about, yeah.
Okay, so this is going to lead us into those three little kind of subcategories of skills that we think will be helpful for when you have those feedback conversations. So we're going to start with growth-oriented language. Kathy, I'm going to let you lead us through this.
So the first element of this is getting familiar with some of what we know now about growth mindset, and that whole idea of understanding that there are areas that we can improve on, that opportunities for learning exist if we open up our mind and our hearts to accepting that feedback and looking for those opportunities. And sometimes we have a growth mindset towards the things we're trying to do, and sometimes we may have a fixed mindset. And it's certainly more difficult, I think, as a teacher if you're encountering a resident who's very resistant to learning or doesn't feel necessarily that they need to improve in a particular aspect or element of what's trying to be taught. And we have our own areas of where we embrace a growth mindset, but we also have areas where we can have a fixed mindset. It's not that the person is one or the other. We can have different mindsets depending on the scenarios or context in which we work. So part of our job, and this relates to the messages from earlier in the presentation, is around that motivation and encouraging and helping our learners know that there are areas that they can improve on, that they can expand and grow from. So we'll give you a minute and you can look at the cartoon. There's always some applicability from these cartoons to the topic area.
Yeah, so after you've seen the cartoon, you'll probably note, and after Kathy's description, that one person in this scenario has more growth-oriented view of math, and it's the mother, and the son is more fixed, it's a problem, can't solve it, don't want to do it kind of thing. And as Kathy mentioned, we can be both. So we'll put up this, and feel free to pause if you want to digest some of these points, but Kathy, do you want to talk through any of these?
Well, I'm just going to really encourage people to pause and actually have a look at, this is an infographic. It's a really good a way of comparing fixed and growth mindset and looking at what happens when a learner is confronted with a challenge and how they might be processing that versus another resident. And so it can help us, I think, adjust the way, or at least understand better sometimes where residents are coming from. And certainly what we're trying to do more and more within any kind of learning situation is to try and nurture more of a growth mindset towards learning.
Yeah, I couldn't say it better. The whole thing is about the nurturing, it's about shaping and framing the way you deliver your feedback in such a way that it's always about growth and getting better, and it's okay if this thing isn't quite there yet, we'll get there. Yeah. And it's all about helping the learner always stay in that growth mindset area so that they're always seeking to get better. And the same for us, because we're lifelong learners, all of us.
Yeah. So vocabulary is one of my favorite things because what we say does matter in so many ways. In fact, we have a really good module in our EDI course on Canvas that is all about language. But just again, take a second and read the comic here. I think we often do come across as having a coded message in what we say to learners. And what we want to do is adopt language that's going to nurture that growth mindset and come across as more encouraging and motivational and stuff like that. So I think I love this particular piece of advice. Something can need improvement. Well, that doesn't necessarily have to be a huge criticism. But if you say poorly done, it feels more personal. So we want to avoid words like poorly done. It's not to say it wasn't poorly done, but it's how you say it sort of dictates in some way how it's going to be received.
Yeah, totally. And and this really resonates with the previous thing we talked about with growth mindset, because poorly done kind of sounds like it's over. Like you just can't do it. Yeah. You're not there yet. What does that imply? It implies you're going to be there at some point. Or needs improvement means you can improve. The language is really, really important for encouraging the growth mindset.
And this came out of a study by Dr. Shelley Ross at the University of Alberta, looking at field notes from family medicine residents, and they were able to determine which ones were done really well. And they realized that there was consistently terms that showed up in these really excellent field notes, and these are the terms. So just using language like next time, or try, or consider, or explaining things like you can do this because, maybe of the impact it might have on a patient or something like that. And then when something's done well, you want to say continue doing that, because learning is about continuing to do the things that are working and doing them well. And sometimes sometimes learners don't always know that those are the things they're doing well. So you want to be very explicit about the things you want them to continue doing. So I think these are excellent suggestions for the type of vocabulary that we can apply, both when giving verbal feedback, but these expressions are also excellent for narrative feedback.
Yeah, and just having them in your repertoire, it almost forces you to come up with some specific feedback, because consider what? Well, consider doing this. It kind of makes you, as opposed to good job.
So I copied these after I went to a workshop that Shelley delivered. I actually copied them on a piece of paper in my office, and I put them where I could see them, so that when I was doing feedbacks for me in family medicine, it was on a field note. I said, okay, which one of these expressions applies, and I would then put it into my field notes. So little cues like that in your environment can really help you improve.
They can cut this out later if it's no good, but so faculty development is going to have magnets with these sayings on, so if they want to contact us, our contact information will be at the end.
Absolutely.
Oh, and I forgot about this. You want to talk about this,
so Rob Woods here at the University of Saskatchewan has done some work on looking at the quality of narrative feedback. And this is a wonderful website that you can visit. You can take the content of written feedback that you want to give and insert it into this website tool, and it will tell you whether or not it's good feedback or not, and then help you to improve the quality of the feedback that you give. So it's very practical, and it is a way of you getting feedback to learn how to give narrative feedback more effectively.
Excellent. The third sub kind of concept we wanted to talk about was the ladder of inference. I'll let Kathy start with this.
So the ladder of inference is one of those things that I think I first learned about during an MBA, but it was a light bulb went off. It was like an aha moment, because I realized that so often in my own interactions with people and with learners, I would go up this ladder of inference. So it's sort of like taking some information or context and then quickly, which our brain does quite well, making assumptions or decisions based on what I think I saw or observed. And sometimes you're right, but a lot of times you can be wrong. And so if you just look at this is a very simplistic diagram of the ladder of inference, but you're going to make an observation, you're going to select out certain pieces of what you observe, and of course we all do that with the unconscious biases that we have, or maybe what we've heard from other people that have influenced our thinking about someone. We're going to interpret that, we're going to think they don't care enough about something, or when in actuality maybe they just had a bad morning and their kid was sick. I mean, there's just so many things, but we often jump to these assumptions, and that's what the ladder of inference does. It helps us to realize that there are many stories that might explain what it is we've observed. And so rather than go up the ladder of inference, we've got to be curious and lean into and talk and find out what was behind what we observed, but not jump to conclusions.
Yeah, so this slide is similar to the last one, but this has some of those questions that Kathy was kind of getting at in terms of asking ourselves as we're climbing up this ladder. And sometimes I think we actually skip rungs on this ladder, and we climb up very fast sometimes and make some broad generalizations based on some observation that we made.
That actually turn out not to be fair, and not to be
totally
accurate. So what I like doing is actually asking myself, am I on the ladder of inference? Or if I'm with a group, are we on the ladder? Because you can get groupthink, you can get everybody sort of on board with the same idea, when in actuality we're completely off base and we haven't checked our data or checked our assumptions, or maybe become more aware of our own biases. We haven't done any of that work. So every now and then I will be with a group and I'll say, okay, are we on the ladder of inference here, and do we need to step off and reassess? which is a really important thing to do when you're in the role of a coach. Or you're wanting to give feedback, you really need to make sure that you're approaching something from solid ground, not your interpretation. So, I mean, there's so many examples that would come up in day-to-day practice with learners, but, you know, you can have someone who's always late, and you'll just make the assumption that they don't care about the clinic schedule, or they're being disrespectful of the staff, or they sleep in, or, you know, whatever. Well, it may be that there's only a certain time that they can drop off a child. Very important. And there's no wiggle room around that. But unless you check to see what's going on, then you can make all kinds of assumptions, which is what we do when we're on the ladder of inference. So this can be a really helpful tool for getting you to think about what else might explain what's going on here, and knowing that you want to preserve that relationship, because we talked about relationships as being really critical as a coach and giving feedback. If we want to preserve those relationships, then we can't go on the ladder of inference. We need to sit down and have a heart-to-heart in a safe environment, and just kind of do a little fact-checking.
Yeah. I mean, you just have to think about when somebody makes an assumption about you, that's unfair, what that feels like. It's not going to help build relationships. It's all about asking questions, digging deeper, finding out what's going on, and not making those assumptions.
Being curious.
Being curious.
Yeah.
And in the ARCH model that we're going to talk about, it's that interactive asking questions kind of thing. I've added a couple arrows to this slide, because this is kind of how insidious this can be. The beliefs that you develop then will influence what you select the next time with that same learner, right? Because if you think that they're lazy, then they do something else, and you interpret that as part and parcel of their laziness.
I knew they were lazy.
Yeah. For those of you familiar with
spirals.
halo and horns effect, it's kind of like that. You start feeling a certain way about somebody, and then you frame everything they do that way. So you select data that supports you, confirmation bias and all those kinds of things. Lots of overlap with biases. And furthermore, the actions you take, so the feedback you give that learner, or some of the things you may do, might actually change what they do next time, and you want that to be appropriate and accurate. You don't want them to change something based on feedback you gave that was a result of some assumptions that were unfair. So your actions ultimately could have a big effect on their performance the next time, kind of thing. So we want to make sure that we don't do it. The other thing that I thought of, Kathy, is the ladder of inference is also kind of a softer way of, you know, calling out somebody if their biases are you know, coming into play and they're being unfair, let's say. I think it's safer to just say, well, this sounds like we're maybe climbing the ladder of inference.
As opposed to, you know, I think you're wrong, or
yeah,
you're biased,
you're
or
unfair,
yes, exactly.
all of those kinds of things.
It's a very safe way of bringing up these really important considerations, but doing it in a way that's very acceptable and not threatening and not personal.
Yeah, and saying we helps too. So I think we're going here.
Yeah.
And kind of being along, and that fits the whole coaching philosophy. It's two people working to get better, essentially. So these are just some tips.
Yeah, they pretty much, I think, reiterate what we've just said.
I think so too.
We all do this, so we're not doing the blame game or anything like that. We do this too. We just need to be aware of it, and we have to be willing to climb down. That's the key. And that curious, what else might be going on here? I remember doing a Crucial Conversations course once, and they used to ask the question, why else would a reasonable, rational person have done this? I've made an assumption about, but why else? And then, of course, you can come up with 100 different reasons. So just asking what else could be going on here, and that being curious and open, and turning your assumptions into questions.
Definitely.
I love that.
All right. So that kind of takes us to the end of the second part on skills, and we want to just conclude with one primary framework for you to use for conversations, and we're also going to use the Royal College model a little bit here. But the first thing I think we want to say is that feedback should always be interactive. It shouldn't be just one direction. You should have your learner involved. And as we pointed out earlier, quality feedback in a coaching framework is learner driven. It's focused on what the learner needs to know, where they need to go, and how you can help them get there, essentially. So it should always be interactive.
Yeah.
So we're going to use the Royal College framework here because it's nicely laid out. And what we're talking about here is more coaching in the moment. Coaching over time, we do sessions on coaching over time. We use the R2C2 framework a lot for that longitudinal process.
Yeah, it's often geared more towards competency coaches or faculty advisor role in family medicine, whereas coaching in the moment is really what's happening day to day when you're interacting with the learner. And the Royal College has some excellent coaching modules that are definitely worth checking out.
Yeah, and so the coaching in the moment will apply to all of you,
Yes.
because you'll all do coaching in some way or another with learners.
Yeah.
So we just kind of, for those of you who are Royal College physicians especially, will be maybe a little bit more familiar with this. But this is the overall framework of an effective coaching feedback strategy, and we're going to give you one model or framework for the conversation piece. But you'll notice the other pieces in here, and I think we've talked about them.
We have,
certainly
because rapport is around the relationship.
Yeah.
Expectation is that thing we were talking about, objectives.
Yeah.
Like, making sure you're really clear on what the expectations are in that particular situation. We've talked a lot about work-based observations, that kind of stuff. The conversation is what we're going to talk about because that's the skill. And then narrative feedback or providing some kind of record of and that's what happens with EPAs and things like that. So this is a pretty straightforward model, and I actually think it applies no matter what specialty you're in.
Yeah, I agree. And as Kathy mentioned, there are modules. You can Google them. There, we have a website there as well for this framework as well as those coaching modules. So Kathy, do you want to talk through the ARCH model?
Well, I'm gonna actually leave some of that to you, but
okay.
I think having a framework, when we're busy in a clinical situation, it can be really hard to remember everything that we need to do, or if you're sitting down and you're even a little bit nervous about giving feedback to a learner, or you're just getting used to doing this and you need to practice it yourself in order to get it. Having this kind of approach is really helpful. And what I like about this, and it models many previous approaches to feedback, is just asking the learner how things went for themselves. And I like asking what went well, because we're often very quick to self-criticize and to go to the thing that didn't go right. When we want to continue to reinforce the right things that are being done, so I do like asking what went well, and then after we've had that conversation, just saying, is there anything that didn't quite go so well, or was there an area you thought you might like to try and improve? So that A is just to allow and ask, basically.
Yeah, and in my experience with the residents in the TIPS program, the what went well often does not get answered. It's right. Like, well, I forgot to do this, or I should have done this. And I'll stop them and I'll say, okay, we'll get to that. Is there anything you really liked about it? Is there anything you thought was strong? Yeah. And they'll usually get there, and maybe they won't. And if they won't, that's okay. Then it's more your job to point some of those things out. Well, don't forget you did this, and keep doing that. But don't be thrown off if they don't do that, because they're not used to doing that. Learners are typically, especially in medicine, focused on all the things that they did wrong and what they need to improve on. And one of the kind of keys to teaching effectively is diagnosing your learner, and this gets at that. It's finding out, how insightful are they? Are they aware of these things? And to be honest, some learners are more insightful, and that'll take a lot of the onus off of you, and then you can just ask them questions. Okay, so what might you do differently next time? And they'll say, well, I need to do this differently. I need to ask this question differently, or hold this instrument a different way. They might know that, and you might not have to do that. It's just encouraging them. Or they might be more like Zach and kind of out to lunch, and you might have to give them a little bit of, some
specifics.
tips.
Yeah. So we've talked about reinforcing what's done well and the importance of doing that. And this example, I agree, your history was well organized, I think is a good example. I might even try to be even a little bit more specific or explain why I thought it was well organized. But that reinforcement of what went well is an important piece of doing this.
Yeah, and you're right. You can often look at good feedback and think, well, actually, that could be a little bit better. It'd be like, well, a lot of people when they do their history, they have this before this, and so you did a really good job of making sure that you found this out before you went into this direction. Yeah. And so being even more specific is the more specific, the better.
And then getting some confirmation on the area that needs to be improved is the next element of ARCH. And I do like to get into very specific learning strategies. I will often give a particular video I want them to watch, or refer them to a website or a particular resource that covers the area that we've been discussing. But because I feel like that facilitates the next step. So this confirmation is the next step of ARCH. And having a plan. And what's really, I think, important about this is that continuing medical education is moving towards physician learning plans. And some residency programs are now adopting learning plans into their periodic reviews or their quarterly reviews, because they're trying to get physicians to be more reflective and to be looking for areas to improve and then deliberately coming up with a plan. And sometimes that plan will then allow physicians in practice to get Main Pro or MOC study credits. So in a sense, by helping a learner plan for improvement, actually doing something deliberately to improve, you're setting them up for a lifelong learning approach that is being reinforced, I think, by both the Royal College and the College of Family Physicians.
Yeah, and from a psychological perspective, making a specific plan, you're more likely to do it than if it's more ambiguous and generic and that kind of thing.
Well, when you think the lessons that we can take from music or from coaching in sports, oftentimes there is a very specific plan as to how they're going to master a particular piece or instrument or shot or whatever it is. So now we just need to translate that approach into medicine. And then the whole concept of deliberate practice.
Yeah.
This, we do have to be consciously involved in getting the practice in to up our performance.
Yeah, and it doesn't hurt to role model that deliberate practice as the coach as well, that you're doing the same things. I just want to give a quick example of this from the TIPS course. Many of you will know we do 2 days, and they do a micro-teaching session both days. And so at the end of the micro-teaching feedback session, where they get feedback, it's interactive, and they get it from the facilitator as well as their colleagues, the last question we ask them is, okay, so next time you teach or next time you do this topic, what's one thing you might do differently or incorporate, or even what's one thing you'll make sure you keep doing. If they really did a really outstanding job. And so the next time you see a patient with hypertension who's obese, what's the first thing or first question you'll ask, or just something like that, so that they have a specific plan for the next time. So having that conversation is really, really important. I want to just echo what Kathy said earlier. Just having a framework in mind takes a lot of the onus. You just walk through this process, and takes a lot of the onus. Did I remember to ask them how they're? Just ARCH.
Yeah, and this takes deliberate practice on our part in order to be better at giving feedback.
Yeah.
So this would be something else that I would copy and put somewhere so that I can glance at it as a reminder to be doing more. We might have to think about doing some magnets for ARCH too.
And I also want to say, for those who don't like acronyms and can't remember what anything stands for, probably you'll be good with this, with the basics on the right side of this, with ask them what they did well. and what they maybe struggled with, and then reinforce, make sure that they know what they did well and they have a plan for the future. And if you do those components, that's fine too. But for those who like acronyms, it's
The
pithy.
ingredients are here.
Exactly.
So I think the questioning, one of the things that we've been talking a lot about is coaching. And one of the elements of being a good coach is asking powerful questions. I think a lot of people think coaching is about telling someone what to do, when in actuality it's more about asking and figuring out where the learner's coming from and what they need to do to improve. So that's what these powerful questions, I think, do, is they really help you interact with the learner in a positive way that comes from the stance of being a coach.
Yeah, and we hope by giving you some specific types of questions to ask, it will just make your job easier. And it's all about, as Kathy said, gleaning understanding into where they're at, what they're thinking, so that you can help them move on and improve.
And there's a plan.
Yeah.
It's not read more. You definitely need to get away from that.
Yeah. If you watch this video and still write read more, we haven't done a very good job.
Yeah.
So we're working hard on developing and fostering a coaching culture within medicine. And so Kathy alluded to the coaching work we've been doing with physicians, and there's coaching in PGME and UGME, and we want this mindset to kind of permeate throughout medicine so that it becomes like tennis, where it's just natural. The best tennis player in the world has
a coach.
So that's kind of what we're aiming for in terms of, in a broad sense. Anything to add with this?
I don't think so. I think that pretty much sums it up. It's about what each of us does individually, but it's also about that collective change. And there really did need to be a culture change in medicine, because traditionally we've had a very blame and shame approach to medical errors, and it hasn't done any of us any good. It takes a toll on the physicians, on the learners, and it doesn't necessarily improve patient care. And the idea of creating this more growth mindset coaching approach, where you're really looking at integrating quality improvement in everything we do, I think has a much greater chance of resulting in better patient care, but also doing it in a way that we can be happy in our jobs and feel good about what we're doing, and have solid relationships, because we haven't done the things to each other that you do in a blame and shame environment, which really is not good for relationships or developing rapport. So
good, excellent.
Chris Watling was the postgrad dean at Western. He's written a lot about music coaching, I think, and what medicine can learn. We can give you a minute to read this, or do you want to take a second and read it?
No, I think they can read it and probably pause it. I just want to highlight this kind of encapsulates a lot of what we've been saying.
Yes.
And I've bolded some of the kind of key components that we've tried to talk about. And really, this is the culture we're talking about, is just where everybody wants to get better, have positive, healthy relationships. If improving at the cost of psychological damage down the line, there's no need for that anyway. So,
no, we want to create that psychological safety, the emphasis on quality improvement, and to do that, embracing more of a coaching stance, I think will be good for all of us.
Okay, so the summary. This is basically, these are our objectives. So we're hoping that by now, you'll be able to describe the importance of feedback within coaching. We started off talking about the coaching kind of philosophy and how feedback fits in with that. We looked at a number of different skills. We can think of the Dewey-Finn example of the specificity, the encouragement, the giving examples, demonstration, all of that kind of stuff. And then we looked at the three key components of that might be involved in feedback conversations. We looked at the growth mindset, the vocabulary, and the ladder of inference, which we think might help. And it's not that you have to have all of that in your head at the same time, but you might be having a coaching conversation and one of those ideas might, pop up in your head. And so if any of this helps with that, that'd be fantastic. And as Kathy alluded to earlier, having a framework is hopefully just going to make it a little bit easier, a little bit less cognitive load for you, just to have a way of having those conversations. And it's all about improving learner performance.
Yeah, so we really hope that this talk has been helpful to you. We'll leave you with a final cartoon, and our email addresses are there, and faculty development is always happy to try and help out and support you in any way we can. And there's also a little reminder that Tea Time is our regular faculty development offering. It's geared to the fellows in the clinician educator diploma, but it is open to everyone. And we talk about stuff like this, and there's often really good conversations, and it's fun to be a part of that community and being around other people who are really keen and excited about medical education. So happy to have you get in touch with us or to come to one of our future tea times. And all of this information is always available on the faculty development website.
Super. Thanks everyone for joining. Good luck with teaching, and feel free to connect at any time.
Take care.